Hello, everyone, and welcome to our live talk. I'm Madina Estephan. I'm a medical doctor and public health expert. And I'm delighted in partnership with Sensemakers to run the live talks around the health and healthcare, inviting international experts. We will be discussing weekly different topics, share our experiences and spread innovative ideas around healthcare. For those who don't know who are Sensemakers, we are a worldwide community of experts with different skills and different backgrounds. We are aiming to improve the longevity of organizations by empowering people with effective skills and tools by improving health span. And I'm particularly delighted today to introduce Dr. Hanine Estephan, who is International Healthcare Executive. She is passionate about e-health, and we're going to discuss very hot topics about e-health, myths and realities. Welcome, Hanine, and floor is yours. Please, I let you introduce yourself.
Thanks a lot, Madina. I'm very delighted to be a part of this session. So just to give you a bit of background about myself, so I'm an epidemiologist by training, and after finishing my PhD, I started working with the World Bank and in healthcare consulting, focusing mostly on improving healthcare outcomes across multiple geographies. So during these years, I've learned a lot about the challenges facing healthcare systems, and traditional solution failed to address these. So I started to explore more innovations and different innovative solutions to address these challenges. And hence, this is how I moved to the digital health space. And since then, I've been advising multiple digital healthcare companies across different geographies in the US, Middle East, and Europe.
Thank you, Hanine, and welcome again. Today, the consultation online or monitoring of the health parameters at distance, or even getting prescriptions and treatment online is not a surprise. What do you think about this adoption of digital health and the emergence of the digital space in the new way of treatment, actually, of patients?
Yes, indeed, Madina. So digital healthcare market was sized about 86 billion USD in 2018, and it expected to witness a massive increase, about 29% growth rate by 2025 to reach about 500 billion. So as you can see, we expect to see more penetration and adoption for both the patient and actually the doctor to use these tools. And COVID came about to actually even accelerate further that adoption and that penetration rate. And we've seen massive increase in demand across geographies. So we're witnessing this new revolution of telemedicine. So just to give you an example, so if you're here in the UK, only prior to COVID, only 1% of the 340 million consultation or so on annual visits for primary care were done using video teleconsultation. But just within a few weeks of COVID, this number grew by 60 to 600% increase in the number of teleconsultations through different multiple providers. And we've seen that same number in France with Dr. Lieb, and in Sweden with CRI. So we have seen that the numbers look very, very encouraging. And I personally believe this change in behavior will be sustained even after COVID. Maybe not in the same growth level, but telemedicine will for sure emerge as another safe and convenient option to complement the face-to-face physical medical consultation.
Yes, definitely. The period of COVID, telemedicine was in the right place, I will say.
Yes, I mean,
how about the myths?
Sorry?
Sorry, yeah. How about the myth around the e-health, which we are believing in?
Yes, indeed. So there are like few myths on telemedicine and e-health in general. So the fear that this is going to replace actually the human interaction 100%, or the fear that it's not possible. You know, you have like two antagonists here. Like people say it will be 100%, you know, telemedicine, and people are saying no, it's not possible to be done online. So so for the first aspect, it's not possible to be done online. That's not true, because about 80% of the conditions for primary care could be actually done through a video consultation. And then the second option, it will replace 100%, you know, the physical face-to-face. That's also not true, because you will still need the physical face-to-face to complement that aspect. So another myth is around the technology used, and it's overwhelming, it's very hard to use, etc., etc. And this is also not correct, because it could be overwhelming or intimidating for a lot of doctors or patients, but in reality, if the design or the user experience is really user-friendly, or if the design was incorporating input from physicians, then you will see it's very easy to use. Similar to when patients start, or people in general started adopting the use of, you know, phones or other tools, this will become something of the norm to them as well. Another myth is, you know, the doctors will think, oh, I'm not going to be compensated for my time, or the patient will think, oh, it's going to be too expensive. It's not true, because a lot of governments around the world are starting to reimburse for teleconsultations, and not only governments, also private insurance and public insurance. So it's also important to clarify these aspects.
So several myths are gone after you're explaining them so well. So, and at the same time, when I'm listening to all this tremendous e-technology advances, the question coming to my mind is, how about the productivity? Does it mean that the productivity increased and we're doing better than before as a doctors, as a consultant specialists?
Yes, indeed. So I want to highlight here, there are like different models of telemedicine, and some are more efficient than other. So for instance, you have the asynchronous model, which is based on a written medical questionnaire, where a patient will fill out, you know, all the information, the symptoms, the input, the previous history, and that will be reviewed by a doctor. On the other side, you have the video telemedicine, which is more, you know, available and common, where you actually conduct a video consultation where the doctor collects that information directly from the patient. And there is a third option, which is a mix between the video, which is preceded by a written triage system or triage methods. And obviously, all of these different models have different impact on the productivity and the clinical efficiency of the doctors or the healthcare professionals in this situation. So a more asynchronous, which is a written-based questionnaire, doctors can review and process treatment in less than 1 minute, because everything is automated based on AI and different models behind the platform. Versus with video, they will still need that 15 minutes to actually engage with the patient and make sure to figure out what is the diagnosis and what's the right and suitable treatment for the patient. So clinical efficiency will vary by model, but it's definitely, if you manage to automate it more, it becomes more and more efficient. So for instance, at ZAVA, because it's mostly asynchronous, we can, like a doctor can process about 1,000 consultations per day compared to a 40 consultation at NHS. So you see like the massive, about 20 times more efficient. So this is very important to highlight.
Yeah, right. From one hand, there's a question about efficiency, and on the other hand, there's questions still about this relationship between doctors and patients. I mean, I remember my first time, my first teleconsultation, I was really happy to have this option in COVID situation. and my patients were happy as well. But it was quite strange to start it first time. I mean, do we need some kind of new skills or skills around the communication to be able to build the relationship with patient? And somewhere it's definitely challenging to express empathy or to express non-verbal communication. What's your opinion about that?
Yes, I mean, indeed. So telemedicine, you need to adapt, you know, to telemedicine. So effective doctor-patient communication is very central clinical function in building that trust and therapeutic doctor-patient relationship. So as I mentioned before, because you have different type of models, so for some models it's very hard to express that non-verbal element, such as the written questionnaire model. But in the video aspect, you have that option a little bit, but it's limited. And that's why you need to supplement it with other, you know, maybe IT feature, and when possible, follow up with messages, follow up with documentation to make sure that the patient is informed, he is doing the right and following the right protocol of treatment. So that's why it's very important to have these training to make sure for the healthcare professional to make sure that they deliver the message that they would have delivered otherwise in a normal physical face-to-face setting. So for instance, for ZAVA, we make sure, because it's asynchronous most of the time, we make sure to have a lot of a possibility to do a lot of messaging back and forth to, you know, elaborate on issues that you were not able to capture, for instance, and or clarification that needs to be, you know, clarified and were not possible to be clarified through the automated written questionnaire. So indeed, all the doctor will need to follow a very good, comprehensive, unique new type of communication skills that is adapted to the different model of telemedicine.
I'm thinking especially we're very poor in the medical curriculum trainings around the communication, and definitely there will be emerging programs or on communication skills. So actually the handling the interviews with patients, using motivational interviewing, using different techniques, which probably permits also to what you absolutely right you said about the relationship of trust between doctor and patient. So from one hand there's communication skill, on other hand you have technical capacities of the different platform which can facilitate this communication, verbal and non-verbal. Okay, so my next question is about the benefits of the telemedicine. What compared to the legacy system, how do you think? What is the benefit of the telemedicine, including both economical and organizational aspects?
Yes, I mean, indeed. So there are like different benefits to telemedicine impacting the patient, like benefits to the patient, as well as benefits to, you know, the healthcare professional, as well as benefit to the healthcare system overall. So from a patient perspective, he has or she has access to more convenient, quick, and maybe like actually a broad range of offering of specialties in a very convenient way, and sometimes also it's cost efficient for them, especially if it's also reimbursed by systems. Also, I want to highlight here, so for some cases, it's also much more convenient for them, especially in cases of mental health or sexual health. They don't want to engage in a physical face-to-face. They would prefer to go for like an asynchronous to kind of avoid that judgment, to kind of replace that fear of judgment or make sure that doesn't exist. So in terms of the impact or the benefits on the healthcare system overall, obviously it will help in reducing expenses and especially freeing capacity from ER and clinics, etc., etc. Also opening up, you know, the pool of resources to remove geographical boundaries, and this will allow to reduce, the waiting times for the patient and increasing access. I see it in the future it become part of the norm. It will be a mix, so they would complement their face-to-face activities with a telemedicine platform. So it also helped them, reach a broader outlook of patient, a pool of patients, as well as make, the consultation aspect, the logistic aspect of it more convenient for them as well. So
I have the question coming regarding the, you are talking about the absolutely in the right way about the possibility to consult somewhere where is medical desert and we do not have enough specialists, or there is no quick access to care. So we're really going to the world where the access to care will be 24 hours a day, and then there will not be any geographical boundaries. So in reality, I can consult any specialist in the world and sometimes and get advice for the eminent experts in different therapeutic areas. That's also will reply to the big question around the health deficiency of the healthcare systems. Actually, we are running of human resources. I mean, there are less and less doctors, and we have in many countries like France or like Russia, there's a huge problem in the future of having enough medical staff and enough medical doctors, enough different specialties.
Indeed.
So e-health is one way of refilling this gap.
Yes, indeed, like very true. So we know, for instance, there are deficiencies or lack of resources, especially for specialists in remote and rural areas in France and other regions, not only in France and other countries across the globe, and which result in long waiting times, from 3 months to a year to a couple of years, so for different specialties. So integrating telemedicine will alleviate that period of waiting time, and will ensure that you remove all the geographic boundaries and you can have access to a bigger pool of specialists to supplement the current pool of specialists in a small remote or rural area. Indeed.
And during this COVID period, also going to the reality of today, I mean, telemedicine not only replied to this gap in giving the possibility to coordinate the patient's hospitalizations, but also as well by making more secure paths or more secure patient journey. For example, by helping doctors to maintain patients at home and be able to secure the patients at home by regular teleconsultations and regular monitoring of the physical health at distance, was definitely something which in the COVID situation helped a lot to avoid the full emergency rooms in hospitals.
Indeed. So you want to remove that exposure element to new infections here and there, and especially in COVID time. That's why we've seen that massive surge and boom that I spoke about earlier. So people, don't want to try to go and to see doctors and go to clinics where you could have infected people around. So yeah, this definitely is a plus.
Do you think that we will be able to have the multidisciplinary team interaction in the future e-health systems, and, for example, get the multiple advisors from different consultants for the same patient? That's one thing I'm thinking about. Or be able to do the multidisciplinary committees like now in many specialties to take decision concerning the care of the patient.
There's a different variation of it. So luckily the cases I would believe that you would tend to treat in the primary care setting of a telemedicine condition. So that multidisciplinary approach is not necessarily there. You have, however, if you are thinking about telemedicine in the broader term, where you use telemedicine as a software to integrate in a hospital setting, and then yes, you will be using it with a multidisciplinary team, especially if you are treating a case, let's say in rural France, or and then you have another team present in Paris, then yes, you can engage in a multidisciplinary discussion to treat a particular case. But in the regular, normal understanding of a primary online care provider, no, most of the time, because it will be only a doctor speaking to you, either like video consultation or through a written platform. However, you also, in some companies, or different companies address this differently, you would have a customer support specialist who would follow up on the logistical aspect with the patient. If some additional question related to the user experience, they will follow up on that. But not from a clinical perspective. Some very small percentage of company will have also nurses to follow up with patients after being treated by video or via the written questionnaire, but not all of them. This is not the common, approach. When a case requires a specialist care, then the patient, the GP, will, the general practitioner, will refer the patient to be seen by a specialist. So at this stage, it's not very common to have the bouncing back and forth for the regular players, such as, ZAVA, Dr. etc. But for other players, they do second opinion and engagement and discussion of the case that exists. But it's more, I would say, more developed in the US rather than in Europe at this stage.
Yes, in some digital platforms, you can refer to the specialist, yes, and you have the option to even send the documents and share the patient, the information about patient letters and so on, results, biological results, results of the exam. From one side, it's facilitating the interaction, yes, between different specialists, but for now, I haven't seen any possibility of having virtual space there to be able really to meet each other and discuss around the patient case. That's what I was thinking about multidisciplinary approach.
So there is another, like the variation of that, as I mentioned in the US, there are players who would engage with let's assume a GP, will reach out to a specialist doctor and discuss the case following, the consultation. But that does not exist yet in Europe. So it's in the US. Very few of them.
My understanding is right. You mean they will discuss in the virtual place when the patient is there, or it will be a posteriori discussion?
It's an a posteriori discussion at the moment, but they are working to improve it. So I think the company Rubicon, if I remember clearly.
You get customers, and what channels are you using to communicate with them?
So different companies obviously use a different blend of how to reach their customers. So what I've seen is a combination of offline and online, purely online, or purely, rarely we see for a digital player to be just purely offline. So it's mostly online or a combination of online and offline. So an online would be through a variety of channels, through SEO, which is Google or Bing, or through paid marketing on Google Ads or social media, and some of them also use affiliate channels, as well as above the line marketing channels and the display and the banners, etc., and in some of them even TV ads. The benefit of the online offline channel is just that you anchor as well, the ad of a particular company. So you anchor it also in the offline world. So for instance, nowadays we're seeing like a telemedicine kiosks in pharmacies and malls, where you would be able to actually interact with telemedicine in the offline kind of word in a way or in another. So yeah, that's another approach that people or companies and telemedicine players are using to reach their customers.
Do you communicate directly to the consumers? I mean, to patients, or only to customers like healthcare professionals? That's my understanding.
It's both, right? So it really,
okay.
really depends. Where if you are a B2B model, so a business to business, right, assuming the healthcare professional as your target customer, so you could also use these same channels to address them, but maybe the media platform would be or the messaging would be slightly different. If you are a B2C, which is business to consumer model, so you directly interact with the customer, then you can also use these channels, but then the messaging will be slightly different. So yeah.
Okay, well, I see that we have enough time also to talk about many other questions. We will answer the questions at the end of the talk. Let me bring one more, which is how about the security and data, handling the patient's data there? So there are many different regulations and laws. It can be different from country to country, from one space to another. So what do you think about it?
Yeah,
another myth of
I agree. This is, I think, another myth that says, like, you know, telemedicine providers are not secure. So I would say, I mean, maybe there are some illegal telemedicine providers there who are not secure, but it's becoming a very regulated industry, and it's very, very secure. And the majority of the companies who are operating are, you know, accredited typically by the regulatory agency in the countries they are operating. So, for instance, you have the CQC, the Care Quality Commissions in the UK, that actually go inspect, you know, and check the quality of care, the data confidentiality and security of these players, and they rate them like any other clinic or hospital. And the same is in France and other countries and in the US. And so there is very strict rules around data confidentiality and security, and all the players use a military grade platforms and are 100% compliant with security, and ensure that everything is in line with the related regulators, such as the Information Commission Office in the UK or the Commission Nationale de l'Informatique et des Libertés in France.
One more question coming to my mind, that okay, data security, we have laws, we have really companies who are working to make it sure and secure for patients and doctors. In some countries, maybe it's less evident than in other countries.
It's true.
How about using the different type of other, let's say, gadgets of the e-health, like applications, like you know, connected objects? Do they integrate it in some kind of platforms? For example, I'm thinking when you can check the level of glucose of patients, they can send it to the medical staff online and adapt the insulinotherapy to the needed glucose level, or other typically at home machines or stuff to monitor the clinical data and the biological data.
Yeah, indeed. So there are, I mean, just to highlight, so yes, there are players who are not following the guidelines, they are not as secure. But I mean, the advice is to not use these type of players. I'm talking here more on the more known. So you would need, as a patient, you would need to look into, make sure you use a player that is GDPR compliant, as well as, you know, accredited by the regulatory body of that country. You see a lot of blood monitors or some urine test kits where you can just do the test and you get like an instant result, and then that instant result is immediately linked, you know, with your doctor, whether online doctor or a physical doctor. It all depends how well these gadgets, I would say, or maybe features or kits are integrated, and how well are integrated with the existing infrastructure or with the new online, you know, platforms. So yes, these exist, and if they are again compliant with the regulations and rules, they should be secure.
Okay. Yeah,
they should be secure as
definitely.
well. Yeah, they should.
What's next about the e-health, I mean, in the nearest future?
So I think
what we should expect in the in the coming years.
Yes, I mean, as I mentioned earlier, I mean, this e-health market size is gonna skyrocket. We're gonna see an exponential growth in this area, and I think this will impact not only one aspect but across the value chain, like prevention, diagnostic, disease management, post-acute care, addressing you know, multiple different conditions and multiple target segments of the population. So women, you know, related to women's health, men's health, chronic diseases, etc., etc. So I think wearables, especially in the femtech area, we're going to see a growing demand for wearable devices to accurately monitor women's health condition. I think this is something that is going to push the femtech as a new subdivision of digital health. I think the post-COVID, we're going to see also increase in funding for both private and public.
Hopefully.
Yes. Research and development will also boom. I will see more relaxation of regulations related to digital health, not on the security aspect. It's more on the support of integration and reimbursement.
Implementation.
Yes, and reimbursement and implementation of telemedicine. I would see more partnership between traditional players with digital solutions across, you know, the different aspects. So not only primary care, primary, secondary, tertiary, like different specialties. I will see more emergence of the digital telehealth kiosk that I mentioned before. So you would see, this is back to the integration between the offline and online worlds. More VR, and we're using that already, virtual reality, especially in cognitive behavioral therapy, mental health aspects, as well as blockchain for security, and make sure that the platforms you use are very secure, as well as obviously, you know, at the basis of all of this is AI and to support diagnosis and treatment. Yes, I mean, these are like my thoughts on what's next.
Can you tell us a little bit about the virtual reality? Do you have any examples coming to the top of mind?
Yeah, I mean, as I mentioned, so it's very applicable for mental health, for cognitive behavioral therapy, and this will help, you know, supplement the counseling and then therapy treatment. So will kind of add a second layer to make sure that the patient is satisfied or towards the recovery journey, I would say.
Do you know about the usage of gamification in the e-health?
Yeah,
that's something which could be also interested.
It's true. It's true. A lot of companies are also integrating games, especially in relation to prevention and behavioral change for patients, to make sure that you know, they stick, you know, maybe to taking the medication on regular basis, or you know, following a specific lifestyle that is healthy, like diet that is healthy, exercising. So they make it in a way that it's fun, at the same time ensuring, you know, that they get the benefit of the health advice, basically.
Yes, from educational purposes. We did the big round of questions. We discussed about e-health, and definitely health is something which is reality. Definitely it's a way of exercising the medicine today, and the future is, we talked about few myths of the digital health, and you brilliantly said that it stays as a myth. And digital health adoption is increasing everywhere, including Europe, where we are. And the market of the digital health is going to grow in the nearest future, hitting several hundreds of $billion. That's a
500
huge,
billion.
huge,
Yes. This is the expectation. 500
huge
billion.
finger.
Yes,
And
yes.
definitely medical world needs special skills around communication skills about handling the digital patients and making that work on the long term, introducing the trust between doctors and patients. And the future is really exciting because we have a lot of e-technologies coming, new e-technologies in virtual reality, in blockchains, in artificial intelligence, which makes the e-health even more attractive area. So with that, I would propose to close down our session. And once again, thank you so much to reply to my invitation and be able to join me for this first and prime live talk on HEALTHSPAN LAB.
Thank you. Bye.
Bye-bye. Take care.